Nearly 200 workers fired yesterday from the Minnesota Department of Health are suddenly trying to figure out how to support themselves.
Meantime, the health department warns that losing more than $200 million means public health efforts will suffer, and they worry that more cuts are coming. Fox 9's Rob Olson is live for us in St. Paul tonight. And Rob, you talked to somebody who lost their job.
Yeah, very suddenly yesterday, a lot of employees came to work, and by the middle of the afternoon, were walking out of work. 170 employees cut, 20 others that had recently been hired had those offers then rescinded. And as you mentioned there, it's kind of a twofold story. The effect on public health by losing so much money so suddenly, and the effect on so many employees who are all now out of work in the same field at the same time.
It's really distressing to think about because there is no world in which I can just go apply to a new public health job when 200 others are just recently let go and doing the exact same thing.
Olivia Dillon was a temporary employee at the Minnesota Department of Health, working there in rabies and avian flu response and prevention, hoping her job would eventually become permanent. Instead, she was terminated halfway through the day on Tuesday, along with nearly 200 others, and says it will certainly affect their response to outbreaks.
It might not be as thorough, or it might not be as prompt as it's needed to be to prevent further spread of illness.
The MDH commissioner says testing sent to their labs will be much slower too. Just some of the effects of a sudden cut of $220 million in federal grants, with worries it is only the beginning.
We are 50% federally funded, so when you talk about, are you concerned about the federal resources, I am highly concerned.
With Minnesota joining 22 other states and the District of Columbia in a lawsuit to restore the funding on the grounds they were approved by Congress, there is some hope they might be reversed. But the MDH commissioner says they can't count on anything long-term and believes public health will suffer.
We are used to sort of working on a shoestring budget, but I would say for the health of our people, for the health of Minnesotans, you don't want to work on a shoestring budget for public health if you don't have to.
Beyond that, there's the personal impact of finding jobs when so many are also so suddenly in the same boat.
Even at the federal level, where there's thousands who are just let go, I can't imagine any of us really have a soft landing.
Now, the cuts here to the Department of Health, the federal funds, these were grants, COVID-era grants that did have an expiration date. The bulk of it, though, would sunset in the middle of next year. So MDH said that gave them time to complete projects, but also secure other funding. And so to do so suddenly meant a lot of quick decisions had to be made, affecting a lot of people, and certainly quickly affecting service. In St. Paul, Rob Olson, Fox 9.
All right, thank you, Rob.